Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to look at the top 5 myths and misperceptions when it comes to knee pain and arthritis. Hey everyone, so today we're talking about the top myths and misperceptions when it comes to knee pain and knee arthritis or osteoarthritis. So we're going to run down these 5 myths and help kind of explain what the myth is and what the reality is. Before we get going, be sure to subscribe, get those notifications so you can get all of our content and videos, and be sure to smash that like button if you find something useful from this video. So myth number 1 when it comes to knee pain and arthritis is arthritis or osteoarthritis is simply a wear and tear diagnosis. So I'm sure you've heard this many of times about, wear and tear, degeneration, degradation, breakdown of the knee joint over time from stresses on the knee joint, from lifestyle, from sports and running, maybe you might have heard, from excessive body weight, all these things causing wear and tear and breakdown of the knee joint, and that's why you develop osteoarthritis in your knee and painful knee. But there's a whole other component, and probably as the research is coming out, possibly a much more significant component to your development of osteoarthritis and knee pain is from biological or systemic factors. So we're talking about things like your genetics, we're talking about hormone levels, we're talking about maybe having low vitamin D levels over time. We're looking at obesity, but not obesity in terms of wear and tear, though we're looking at obesity in terms of having high levels of lipids or fats in your blood, having high levels of lipids and fats in your knee joint and your other joints in your body, high cholesterol levels. These are leading to sending signals, cellular signals, sending information that's leading to this increase in breakdown of the joint, breakdown of the cartilage, increases in inflammation throughout the body and throughout your joints. All of this is occurring at a biological level, at a systemic level, and it's a huge component for the development of osteoarthritis and knee pain. So it's not just a wear and tear disease, it's a biological, systemic factors play a significant, huge role. Myth number 2, imaging, x-rays, MRIs, CT scans are the main determinant of what the clinical management of your osteoarthritis and knee pain is going to be. So basically, however significant or severe things look on the x-ray, that's going to determine what the next step is. Should you have a surgery? Should you not have surgery? Or what have you? But the thing to remember and the thing to keep in mind is that there's a very poor correlation between what you see and what you feel. And what I mean by that is there are individuals, you take an x-ray of their knee and they have significant arthritis based on what it looks like. But they might have very minimal pain and discomfort and symptoms. Same token, you might have someone who has very significant symptoms, pain, discomfort, and you take an x-ray of their knee and they have very minimal arthritis by what you see in the x-ray. So that correlation between symptoms, what you feel, and what your knee looks like and the extent of the arthritis of your knee, very poor correlation. And so what this means is that, just because you have x-rays that show arthritis or moderate or significant arthritis in your knee joint doesn't mean you're destined to have a knee replacement surgery. Doesn't mean you're destined to not have successful outcomes from conservative management. It's just one part of the puzzle. The x-ray is just one part of that puzzle of the overall decision making and the clinical management of your knee pain and arthritis. Myth number 3, if I have osteoarthritis in my knee, a total knee replacement surgery is inevitable and it's going to happen at some point in my lifetime. And this just isn't true. The joint tissues, the cartilage of the joint, the meniscus, the other soft tissue around your knee joint is very dynamic, and it can heal and it can recover, and with conservative treatments, physical therapy, exercise, physical activity, among some of the most important, you can really have improvements in symptoms. You can have decreased pain, you can have decreased swelling, decreased stiffness with conservative management strategies. Only approximately 8 to 10% of people who have osteoarthritis of the knee end up needing knee replacement surgery. So there's definitely benefits and potential with conservative treatment, and a knee replacement surgery is not inevitable. Myth number four, exercise and loading and stresses on the knee joint are going to lead to further damage and breakdown of the knee joint. And actually the opposite is true with this. And the way for the knee joint to heal and for tissues to regenerate and recover is actually through loading of that knee joint and stresses and weight bearing on your knee joint. And actually the best amount of efficacy and support for conservative treatment for managing knee pain and arthritis is physical activity and exercise. Now, does this mean that in the short term, it's not uncommon to have pain and discomfort when you're doing activities, when you're exercising? Yes, you can have some pain, and you will probably have some pain and discomfort in the short term. But we want to think big picture. We want to think long term. And sticking with an exercise program and physical activity for a consistent number of weeks can really have great potential long-term benefits in terms of decreasing pain, improving symptoms, improving activity tolerance, and managing osteoarthritis effectively. So don't be afraid of exercising and loading that joint. Now, jumping from there, we go to number 5, is pain equals damage. So when I have knee pain and I have knee discomfort, that means I'm causing damage and injury and harm and degeneration to my knee joint. And that is not true. Pain does not equal damage. Pain is your body's warning signal. It's the alarm system that potentially something wrong is going on, and you got to look out and you got to be careful. And this is really helpful for acute injuries, acute things. If you're running and you twist your leg or you twist your ankle real quick, that pain is giving you a very important signal to protect that area and to be careful and figure out what's going on. But when you have persistent pain or chronic pain that lasts for months or more, that pain signal starts to not be as accurate, as helpful as it used to be. And so your body is gotten so good at experiencing pain, basically, interpreting and receiving that pain signal. And so things that may cause pain and discomfort in the short term, like we were talking about, may not, and the vast majority of times, are not causing any type of physical damage or breakdown or harm to your knee joint or your body. And that's very important. So it's expected that you might have some pain in the short term when you load that knee joint, when you put weight through it, when you're doing activity and exercise. But you're not causing any increased damage. You're not causing any increased breakdown of the knee joint or any increased harm to the knee joint. Actually, exercise and physical activity is going to be the most beneficial thing you can do. So there you go. There's 5 myths and misperceptions when it comes to knee pain and osteoarthritis. Again, be sure to subscribe and hit the notifications so you can check out whenever we post a new video and don't miss them. Smash that like button, leave your comments and questions, and I'll be sure to get back to you. Thank you very much for watching, and take care.